Okay, and we're back because I wasn't really breathing enough, losing oxygen. I'm not used to doing this stuff. Anyway, but I think it's important. I want to make sure that you guys have the best information and are really keeping your teeth clean since we can't. Because what else do you have to do right now? But yeah, so when you're brushing, kind of break it up into 4 sections. And I really recommend starting from the back of the mouth and moving forward. That way you don't miss it, because the thing I see most is people miss doing a great job brushing the front and then missing the back molars. So when you're brushing, you want to have the toothbrush. Oh, let's see if I can do this. The toothbrush bristle is kind of angled right where the teeth and the gum meets. That's really the most important area. So kind of angled 45 degrees onto the onto the tooth, and then just kind of turn it on and then kind of rotate it around for a couple seconds, move forward, rotate it around a couple seconds, move forward, get towards the midline. And then I actually like to stop at the midline and then come back around from the inside and do the same thing where you're, again, angling right at the tooth and gum line and pulling it around like a couple of seconds each tooth, moving forward to the midline. And when you get to the front, a lot of times people miss the canines here, or their lip kind of starts to bump up and kind of pushes the toothbrush off and away up to the biting surface away from the gum. So I recommend sometimes, if you can, pull your lip down as you're running the toothbrush around, so you can really watch and visualize that you are getting right at that tooth and gum line. So important. And sometimes for the back, the upper back molars especially, sometimes as you open your mouth all the way, it kind of pops the toothbrush out. Your cheek muscles are really strong, you can do that. So sometimes you have to close a little bit in order to get the toothbrush all the way back there, because as you get to when you're at the very back, you want to kind of round the toothbrush around the back as well. You want to kind of get back behind it as much as possible. And closing a little bit really helps you do that. So that's my spiel on brushing. If you can do that with an electric toothbrush, and again, you should right now, no excuses, twice a day, but at least once a day. I say that especially for, people with kids, people who are caretaking for others. It is still tough. There is so much that you're trying to do for everyone else. So if you can at least do it once a day, that's better than nothing. As far as gum care goes, and I've pretty much talked to people as far as whether it's more important for you to be using floss or using a water pick, water flosser. Either way, if we're going with traditional floss, you're getting a nice big thing of it, and then you're just kind of wrapping it around, kind of so you have enough to really hold on to there. And then as you are flossing, you get the, bear with me here. I am not good at this. You're getting between the teeth, and then you're kind of, once you have it between the teeth, you're actually kind of using your thumbs to guide it forward and backwards. And so for each tooth surface you're between. So I'm pushing forward here, and then I'm going to slowly scrape up, and then you can go back in and pull back a little bit and pull up that way. But you want to do that for every tooth. I recommend doing that after you brush, just because as you're brushing, you're actually kind of pushing stuff off of the tooth surface that the toothbrush is working on, but it's almost kind of like pushing it in between the teeth. So I like to brush first and then floss to really just make sure that we got everything out of the nooks and crannies. For some people, using water pick is more important, especially if you don't really have any cavities between the teeth, you just have gum issues, or if you've got periodontal disease and you've got pockets that are greater than 3 millimeters. At that point, flossing is not really doing it. You need something that's actually pushing water down between the gums. With that being said, there are a lot of different ones on the market. I don't like the Amazon, there's a lot of cheap Amazon ones. I am fine with cheap as long as it's effective, but they're just not effective. They aren't as powerful. So you're not really getting the force that you need, the actual water force, the water pressure. Also, let's try drive me nuts. Besides the water pressure, a lot of the tips, the holes are really large, so the spray isn't as focused, and again, not as precise. You can't target the way you can with something like a water pick, any professional water flosser. The other thing that, especially for people with periodontal disease and pockets that are deeper than 4 millimeters, all water flossers really have like this kind of tip here, but it's important for people who really need to target certain areas to have this really small thin tip. That really is what gets, along between the gum, the tooth, and between the teeth better. And with doing water flosser, you're filling the reservoir with room temperature water. You don't want it to be too cold. That will be awful. And you fill it with room temperature water. I usually tell people to start at the medium setting and kind of adjust up as much as you can from there. Some people have really sensitive gums, so they tend to go down, but most people prefer, I know that I prefer, turn it up as much as you can. Just make sure when you start it that you are already kind of bent over the sink so that you don't end up getting water everywhere in your bathroom. So you fill it up, turn it on, and filling it up for some people with periodontal disease, or people just want to add something, you can add mouth rinse in there. You can add hydrogen peroxide. Personally, for periodontal disease, I like a tablespoon of apple cider vinegar. It's very good antibacterial. So do that, start it, and then so once you've got it started and kind of got it at the power that you want, again, it's very similar to brushing. Like you just start at one area and then you have it about 45-degree angle kind of between the tooth and the gum, and then you just kind of go between and you trace between, and you spend a couple of seconds between the teeth, but you basically are tracing and something like kind of rubbing up and down between a little bit here. But that is the way that I recommend water flossing, water picking, whatever. So brushing at least once a day, at least, with a good electric toothbrush that's really going to scrub the plaque off of your teeth. And flossing with either traditional or water. Mouth rinses, that's kind of more of a personal preference unless you have a fluoride issue, in which case we may have recommended a fluoride mouth rinse, or we may have given you a prescription fluoride toothpaste. The thing with the prescription fluoride toothpaste is you want to brush with that as the very last thing you do at the end of the night. So I will say, if you have a prescription fluoride toothpaste, do that as your very last step. You're going to brush with that, spit it out, don't rinse, because really you want to let it sit on the teeth overnight. That's the way it's most effective. So that's really, doing that. Any fluoride mouth rinses. Otherwise, mouth rinses, if you just enjoy having fresh breath, that's fine. Do it whenever, but it's really brushing and flossing that are the main things. So do that. Stay safe. I know we love to touch our faces. I know I do. Stop touching your face. And let's hope this thing ends soon so I can see all of your beautiful, lovely teeth and see how good a job you've been taking care of them while we've had to have this extended leave. All right. Let me know if you have any questions. As always, I'm accessible by email. You can always call our office. We are trying right now to really at least be here a couple hours a day to field everything. And like I said, we are open for emergencies. We are so happy to take care of anyone who needs it. So please reach out to us, okay? All right, stay safe, be well.